I'm going to talk about supply chain management in Namibia and the HR component. Achieving excellence in the supply chain workforce, that's where we're getting to. So an introduction to Namibia for those of you who don't know about Namibia. We have a very large country, 824,000 square kilometers, a population of only 2.1 million. So we have the second lowest population density in the world. We're classified as an upper middle income country by the World Bank, with a Gini coefficient of 74.3, so therefore a very high rate of income inequality. So over half of our population lives on less than $2 a day. This means that the majority of the population rely heavily on the public health system. We do have a private health system, but I think it's 85% of the population get their services from the public health system. So the supply chain for the public health system, the central medical stores, CMS, procures and distributes pharmaceuticals and clinical supplies in one integrated system for all public health facilities. The annual procurement value is about $50 million, I think a bit above that by now actually. And the central medical stores inventory value at any one time is approximately $22 million. The CMS annual procurement value increased over 350% from the 2003 levels, backing up what Rebecca said about the huge increase that we have experienced in the last decade, basically. But the central medical store staff establishment of about 45 staff has barely changed since 2003, so you can imagine the impact this has. The staff at Central Medical Store, the top management, we have posts for 3 pharmacists on the staff establishment, and we've borrowed 2, actually I think it may be 3 by now, pharmacists to try and manage this increase, begged and borrowed from other parts of the ministry because they all realize if the Central Medical Stores doesn't get the medicines, they won't get the medicines. So we have had support on this, but obviously then when we borrow them, it means that there's shortage at the health facilities. Mid-level managers, this is what we call mid-level managers. Someone told, no, these are not mid-level managers, but in our system, we have pharmacist assistants. They do a 2-year certificate course offered at the Ministry's National Health Training Center, and chief clerks. So they have a grade 12 education and a minimum of 3 years experience. Then we have operational staff, warehouse clerks, and work hands. And there's no specific supply chain certification required during recruitment, but previous experience is considered positively. As supply chain management staff in the periphery, we have a regional pharmacist in each of the 13 regions, and that pharmacist has to have a minimum of 6 years work experience as a pharmacist, not as a supply chain manager, as a pharmacist. Hospital pharmacists, the posts are only in the referral hospitals. At district hospitals, we don't have any posts for pharmacists. Pharmacist assistants are the staff that run the district hospitals and also support the pharmacists in the referral hospitals. These are the ones with the 2-year certificate course training. However, about 3/4 of our district hospitals now have a pharmacist working there responsible for ART pharmacy services, and they have been supported by development partners, Global Fund and USAID, CDC. Registered and enrolled nurses at most host centers and clinics are the ones who run the supply chain. These cadres have supply chain responsibilities in addition to their other patient care responsibilities, but they have very limited training on supply chain management. So what workforce development have we been doing? Free service training. The pharmacist assistants are trained in the Ministry's National Health Training Center. We have started a Bachelor of Pharmacy degree course. The first intake was February 2011 at the University of Namibia. It's a 25-student intake, so we've now taken in 50 students because we're on our 2nd year. A Bachelor of Logistics and Supply Chain Management degree program was established at the Polytechnic of Namibia in 2011. That was not in relation with the Ministry of Health, but we plan to tap into that resource. In-service training, we have been making use of the Warehouse Operations Management course, a one-month international course supported by SCMS, run in South Africa, and we've sent targeted central medical stores and regional medical stores mid-level staff to that training. The main challenge we have is staff turnover after they have been trained. So they come back enthusiastic and with new ideas, but then they don't stay with us that long. Also, we do ad hoc basic logistics and inventory management training for facility level staff nominated by their supervisors, and the current level of in-service training that we're able to provide is insufficient to increase the capacity. So actions that we are taking to address our HR for supply chain management problems. We've increased the training of pharmacist assistants supported by USAID through MSH. We had an intake of 10 students per year, and we've increased that over about 4 years up to 25 students a year, which is a significant increase for us. The Bachelor of Pharmacy degree, of course, is a big step forward for us. Supply chain modules have been included in the pre-service curriculum of the pharmacist assistants and pharmacists, and aspects of stock management have been included in the nursing pre-service curriculum as well. We are liaising with the Polytechnic of Namibia's logistics department to develop supply chain modules for different health worker cadres. However, and also the grossly insufficient staff establishment is being updated by the Ministry of Health and Social Services to address both the shortage of posts and the lack of certain skills. This process, however, we started, is it 2007 we started with that, Mr. Habimana? 2007, and we don't yet have our new staff establishment. So it's a process. A whole ministry being revised is a big process. Posts are in the process of being created, however, as we are meeting here this week, for all development partner funded staff, because the funds available from development partners have not been able to meet the staff needs. So we have approached our Public Service Commission at the Office of the Prime Minister, and the ministry has already taken over about 50 medical officers, and we're in the process of creating the posts for all the pharmacists and pharmacist assistants who are being funded through development partners. So hopefully by at latest end of August they should be on our staff establishment, which will help us. And we have also created 8 new posts at central medical stores as an emergency interim measure while we're waiting for the staff establishment revision of the whole ministry. So the Namibia health supply chain is one of the best performers in Africa. We, until very recently, had a service level of over 90% constantly from our central medical stores across the board. Obviously, the increase in workload has put strain without additional staff, so it has dipped a bit. I think we're at 81%, Mr. Habimana? 83%. Currently at 83% service level for all of the items we provide. However, we have managed to maintain the ARV supply chain very intact and service level over 97% constantly from central medical stores. However, the significant increases in the workload without increased staff levels means that the supply chain is now overstretched and very vulnerable. We need to make reforms at all levels of the integrated supply chain, and we need to accelerate those changes so that we can maintain the good results that we've achieved to date. Thank you.